Have you ever woken up with your heart beating a little too fast, a sense of uneasiness you couldn't quite explain, or a tension in your shoulders that seemed to appear out of nowhere? Many seniors tell me these moments feel like just getting older, but they are often much more meaningful. One patient once told me she would lie awake at night, unable to slow her breathing, convinced that it was only stress. I want you to imagine this. You are living your normal life, taking care of your home, making your morning coffee, talking to your loved ones, and deep inside, your body is quietly carrying a load that you cannot see. Chronic stress is not only an emotional weight, it affects your blood pressure, your heart rhythm, the thickness of your blood, and the stability of your arteries. It changes how your brain communicates with your body. It wears down your resilience slowly and silently. And for seniors, this hidden stress can push stroke risk far higher than most people ever realize. After more than 30 years of caring for older adults, I have seen how prolonged stress becomes a quiet force that reshapes the body. Caregiving responsibilities, financial worries, health fears, loneliness, long nights without sleep, or the pressure of simply trying to stay strong for others can create a level of stress that the body can no longer absorb. Many patients told me they thought stress was harmless. They believed it was something they could push through. Meanwhile, their bodies were fighting harder every day. I remember a 68-year-old woman who spent months worrying about her son's illness. She felt tired, dizzy, restless, and experienced a racing heartbeat at night. She dismissed every symptom as just stress. One morning, she tried to reach for a glass of water, and her right hand wouldn't move. That moment changed everything. It was a stroke triggered by stress her body could no longer carry. In this video, I will help you understand how chronic stress affects the brain and blood vessels, which early signals most seniors overlook, when stress becomes dangerous, and the simple daily habits that protect your long-term brain health. If you find this helpful, please remember to subscribe, like, and share Senior Health Daily so we can continue supporting you with life-saving guidance. Why chronic stress raises stroke risk. When we talk about chronic stress, most people picture worry, frustration, or emotional strain. But what I want you to understand today is that stress is not just a feeling in the mind. It is a biological event that spreads through every system of the body. And for seniors, especially those over 60, the effects of long-term stress can quietly push the body toward one of its greatest dangers, a stroke. Let me explain this in a way that's simple and true to what I've seen over decades of caring for older adults. When you live in a state of constant stress, even mild stress, your body releases hormones like cortisol and adrenaline almost non-stop. These chemicals are helpful in short bursts, but when they stay elevated week after week, they begin to strain your system. Blood pressure rises because your arteries tighten, preparing for what the body believes is danger. Your heart beats harder and faster. Your blood becomes slightly thicker, making it easier for clots to form. And your circulation becomes less flexible, less responsive, and more vulnerable. Now imagine this happening inside the body of someone over 60. The arteries are already more delicate. The heart works harder to maintain rhythm. The brain depends on stable blood flow to function well. Chronic stress multiplies the pressure on every one of those systems. I once cared for a 72-year-old man who had been under intense financial stress for months. He didn't show dramatic symptoms. He simply felt more tired than usual and breathed a little faster when climbing the stairs. He brushed it off as aging, but one afternoon, he experienced a sudden wave of confusion that lasted less than a minute. That moment was a transient ischemic attack, a TIA, a mini-stroke. His body had been signaling distress long before he understood what was happening. This is why chronic stress is so dangerous for seniors. It works silently, it builds slowly, and it changes the way blood flows to the brain long before any obvious stroke symptoms appear. I want you to keep this thought close. The body never reacts without a reason. If you feel tension, tightness, pressure, or unusual fatigue, it may be the earliest sign that your brain and arteries are under more strain than they can handle. Hidden stressors seniors don't realize are dangerous, When most people think of stress, they imagine big moments, a major life event, a financial crisis, a medical emergency. But the truth is that the most dangerous forms of stress for seniors are the ones that build quietly, invisibly, day after day. These hidden stressors weave themselves into daily routines until they feel normal, even harmless, while the body slowly pays the price. One of the most powerful stressors is loneliness. I've sat across from so many older adults who told me they were fine, only to later admit that days passed without meaningful conversation. Loneliness may feel emotional, but biologically, it triggers the same stress pathways as physical danger. The heart beats harder, blood pressure rises, inflammation increases. The brain stays alert, even when you're trying to rest. Another hidden stressor is caregiving. Many seniors take care of a spouse, a sibling, or even an adult child. They carry quiet fear, mental pressure, and physical exhaustion. They rarely complain because they feel responsible, but inside their body, cortisol never drops fully. Their nervous system stays activated around the clock. I've watched dedicated spouses age 10 years in just one because of the emotional weight they carried in silence. Even retirement, something society paints as peaceful, can create invisible stress. A loss of routine, a loss of purpose, or the sudden quiet after decades of structure can create internal tension that older adults don't recognize as stress. They simply feel unsettled, tired, or worried without knowing why. Sleep disturbances are another major hidden stressor. Waking at 2 or 3 in the morning, lying awake with thoughts racing, or feeling unrested despite a full night in bed are signs that the nervous system is overstimulated. Over time, this constant activation pushes blood pressure upward and disrupts the stability of blood vessels. And then there is health-related stress, often the quietest of all. Waiting for test results, fearing cognitive decline, worrying about chronic conditions, or anticipating pain can live beneath the surface while the body reacts intensely. The nervous system doesn't distinguish emotional stress from physical danger. It treats both the same way. These hidden stressors keep the body in a survival mode that older adults don't recognize. They tell themselves they are fine, they push through, they adapt. Yet inside, the brain and arteries are struggling to keep pace with the constant biological load. Recognizing these quiet stressors is not about fear, it's about awareness. When you name what is weighing on you, you begin to reclaim control, protect your health, and give your body the relief it desperately needs. How stress quietly damages the brain and arteries. Most people think of stress as something that affects their mood or emotions, but inside the body, it is a powerful biological force. When chronic stress lingers, the brain and arteries are often the first places to feel the strain, even when the symptoms appear subtle. Every time you experience ongoing tension, your body releases hormones like cortisol and adrenaline. These hormones are useful in short bursts, but when they remain elevated day after day, they begin to reshape how your blood vessels function. Cortisol, in particular, can cause arteries to tighten, making it harder for blood to flow smoothly. Over time, this narrowing forces the heart to work harder, and even a small clot can become dangerous if the vessel is already constricted. Chronic stress also fuels inflammation. Many seniors don't realize that inflammation is not just a feeling of swelling or pain. It is a chemical reaction inside the body that thickens the blood and makes it more likely to form clots. When blood becomes stickier, it travels more slowly through delicate brain vessels, increasing the risk of blockages that can trigger a stroke. The brain itself is highly sensitive to long-term stress. Cortisol interferes with the neurotransmitters that help maintain stable mood, memory, and focus. It can also disrupt the brain's ability to regulate heartbeat and blood pressure. Some seniors experience this as a sudden rush of heart palpitations or a wave of dizziness after standing up, without realizing that these are early signs that their nervous system is under pressure. Stress may also provoke irregular heart rhythms in people who already have mild electrical issues in their heart. Many older adults have episodes of silent atrial fibrillation without even knowing it. Stress can tip the balance, turning a minor rhythm disturbance into a full episode that allows clots to form and travel to the brain. I once cared for a patient who believed her symptoms were simply the result of aging. She had a slight hand tremor, her eyelid twitched often, and she struggled with sleep. She assumed these were harmless annoyances, but in reality, they were signals that her nervous system and vascular system were overwhelmed by prolonged stress. Within weeks, she experienced a transient ischemic attack, a warning shot that her brain had been quietly struggling. Stress rarely announces itself with dramatic signs. Instead, it whispers through small changes in how you think, move, and feel. These signals are easy to dismiss, but they are messages from your body asking for relief before something serious happens. Early warning signs of stress-related stroke. Risk. Many seniors live with chronic stress for so long that the body's warning signs begin to feel normal. The signals arrive quietly, softly, and in moments that seem harmless. Yet these are often the earliest clues that stress is beginning to affect the brain and the blood vessels in ways that increase stroke risk. One of the most common signs is a lingering, gentle headache that comes and goes without a clear cause. It may feel like a tight band across the forehead or a pressure behind the eyes. People often blame it on poor sleep or weather changes, never realizing that stress hormones are tightening the arteries feeding the brain. When these arteries remain constricted too long, even a small clot can block blood flow. Another sign is a heavy or foggy feeling in the head. Many seniors describe it as, "My brain feels slow today," or "I can't think clearly." This fog happens because the brain is receiving less efficient blood flow during chronic stress. When cortisol stays elevated, it disrupts the electrical signals that help the brain stay focused, calm, and balanced. What feels like simple forgetfulness may actually be the brain asking for help. Stress can also cause unusual breathing patterns. A sudden need to take deep breaths or a feeling of air hunger may appear during daily activities. This is not just anxiety. It is the body's attempt to correct an imbalance created when stress hormones accelerate the heart rate and disrupt oxygen exchange. Morning blood pressure spikes are another early warning sign. Many seniors wake up with numbers that are significantly higher than their afternoon readings. This happens because cortisol naturally rises in the morning, and chronic stress magnifies this rise. High morning pressure has been linked to a greater risk of both strokes and heart attacks. Small neurological changes can also appear. A subtle tremor in the hands, a twitching eyelid, or numbness that lasts a few seconds may seem insignificant. But these tiny clues can signal that the nervous system is under strain. The brain sends these signals long before a major event occurs, and ignoring them allows the underlying problem to grow. Difficulty concentrating, irritability, or a shorter fuse than usual can also be telltale signs. When cortisol disrupts the brain's chemistry, emotional balance becomes fragile. Seniors sometimes attribute this to aging, but often it is the body's early cry for rest. Neck and shoulder tension that never seems to fully disappear can also indicate rising stress levels. When the muscles around the arteries at the base of the skull tighten, they can limit blood flow to key regions of the brain, creating a cycle of strain and discomfort. These early signs rarely feel dramatic, which is why so many seniors overlook them. But they are the body's first attempts to protect you by asking you to slow down and pay attention. When noticed early, these symptoms offer precious time to intervene, restore balance, and reduce stroke risk before permanent damage occurs. Seniors at highest risk. From chronic stress. Some older adults carry a heavier physical burden from chronic stress than others. They may look calm on the outside, but their bodies are quietly working overtime. These individuals face the greatest rise in stroke risk when stress becomes part of daily life. One group at high risk is seniors with long-standing high blood pressure. Their arteries are already under pressure, and when chronic stress enters the picture, those blood vessels tighten even more. The combination can push the cardiovascular system past its limit. I have seen older adults whose blood pressure soared after months of tension, even though they believed they were managing it well. Seniors who live alone also face a unique vulnerability. Loneliness creates a stress response that is both emotional and biological. The body releases cortisol more frequently, sleep becomes more irregular, and simple worries can feel overwhelming without someone nearby to talk to. Over time, these silent burdens strain the heart and the brain in ways many people never realize. Those with a history of heart disease or previous TIAs are another high-risk group. Their blood vessels may already be weakened or narrowed, making them more sensitive to the effects of cortisol and inflammation. Even a mild rise in stress hormones can destabilize plaque, increase clot formation, or trigger changes in heart rhythm that raise the chance of a stroke. Caregivers are also deeply affected by chronic stress. Many seniors spend years caring for a spouse with dementia, Parkinson's, or mobility challenges. The emotional weight of watching someone you love decline, combined with physical exhaustion, quietly wears down the cardiovascular system. Caregivers often ignore their own symptoms because they are so focused on someone else. Chronic insomnia adds another layer of risk. Lack of sleep disrupts the brain's ability to regulate blood pressure, manage inflammation, and repair vessel walls. When stress and sleeplessness occur together, the brain remains in a state of constant alert. This internal tension is one of the most powerful drivers of stroke risk in older adults. Certain medications can also increase vulnerability. Corticosteroids, stimulants, and some antidepressants may raise blood pressure or alter heart rhythm. When combined with chronic stress, the impact becomes even stronger. A senior who believes they are simply adjusting to a new prescription may actually be experiencing early warning signs. I once cared for a woman in her 70s who had been taking care of her husband with advanced Parkinson's disease. She carried her worries quietly, trying to stay strong for him. Over time, she developed headaches, morning pressure in her chest, and difficulty sleeping. She dismissed these symptoms as caregiving fatigue. A few months later, she suffered a mild stroke that could have been prevented had the signs of chronic stress been recognized. These risk groups are not powerless. Understanding the relationship between chronic stress and stroke risk gives seniors the chance to protect their health before a crisis occurs. Awareness is the first and most important form of prevention. Its voice, and these whispers often sound like everyday fatigue or mood changes. But in reality, they are early neurological and cardiovascular signals that the brain is under pressure. One of the first signs is a persistent, low-grade headache. It may not be severe enough to stop daily activities, but it lingers in the background, especially in the morning. This kind of headache often reflects tightening blood vessels or rising blood pressure caused by elevated cortisol. Some seniors describe it as a heavy sensation behind the eyes, almost like a fog settling over their thoughts. Another early sign is a feeling of mental cloudiness. Many older adults call it brain fog, the sense that thoughts are moving slower or clarity is harder to maintain. They may lose their train of thought more easily or struggle to finish a sentence. This occurs when stress hormones disrupt blood flow to important areas of the brain, responsible for focus and memory. Rapid or shallow breathing is another quiet clue. Seniors often think it is anxiety or age, but it may actually be the body reacting to internal stress signals. When breathing changes, the brain may not be receiving steady oxygen, which can increase stroke risk over time. Morning blood pressure spikes are especially important. A senior might wake up feeling agitated or strangely alert before getting out of bed. This can happen when cortisol surges overnight, pushing blood pressure higher than normal. Many strokes occur in the early morning hours for this very reason. Physical signs can also be subtle but meaningful. Slight tremors in the hands, tingling around the lips or fingertips, or a fluttering sensation near the heart are all indicators that the nervous system is overwhelmed. These sensations reflect changes in circulation and electrical activity, often triggered by chronic stress. Changes in mood can serve as warnings too. Irritability, impatience, or heightened emotional sensitivity might seem harmless, but they often accompany rising cortisol levels. When emotions shift suddenly without clear cause, the brain may be signaling that it is struggling to maintain balance. A tightness in the neck and shoulders is another frequently overlooked clue. Seniors often attribute this to sleep position or arthritis, but chronic tension in these muscles can reduce blood flow and increase pressure in the arteries that feed the brain. These early warning signs often appear weeks before a stress-related stroke. Recognizing them gives seniors a powerful opportunity to intervene early. Small changes in daily habits, better stress awareness, and timely medical support can prevent the silent buildup that leads to a crisis. Seniors at highest risk. From chronic stress. Some seniors are more vulnerable to the effects of chronic stress than others, not because they are weaker, but because their bodies are carrying heavier burdens. Age alone changes how the cardiovascular and nervous systems respond to pressure, and when stress becomes a daily companion, these systems can be pushed beyond their limits. Seniors with long-standing high blood pressure face one of the greatest risks. Their arteries have already endured years of strain, becoming less flexible and more reactive. When stress hormones surge, these vessels tighten further, raising the chances of clots forming or small vessels closing off. Many of these individuals wake up with a pounding heartbeat or a sudden wave of heat across the chest without realizing it is their body sounding an alarm. Living alone can also increase vulnerability. Isolation often magnifies stress levels, and without someone nearby to notice worrying symptoms, early signs may pass without attention. I have seen seniors who brushed off dizziness or numbness simply because they had no one to talk to about it, believing it was just another off day. Those with a history of heart disease or previous TIAs also carry a higher risk. Even mild stress can disrupt their heart rhythm or circulation. A patient once told me she felt her heart flutter during stressful moments and assumed it was nothing. In reality, it was a rhythm change that made her more prone to clot formation. Caregivers, especially older adults caring for a spouse, face emotional and physical load that can be overwhelming. They often put their loved one's needs first and ignore their own signs of exhaustion. One woman who cared for her husband with Parkinson's disease never admitted how stressed she felt. She experienced recurring neck pain, disrupted sleep, and frequent headaches, but dismissed them all. Months later, she suffered a mild stroke that left her temporarily unable to speak. Chronic sleep difficulties amplify stroke risk as well. Seniors who struggle to fall asleep or stay asleep experience elevated cortisol throughout the night. This constant hormonal pressure keeps their cardiovascular system on alert when it should be resting. Morning spikes in blood pressure are especially common in this group. Certain medications can also worsen stress-related stroke risk. Drugs that elevate heart rate, disrupt sleep, or raise blood pressure interact with chronic stress in ways that strain the vascular system even more. Many seniors do not realize that a simple decongestant or long-term use of steroids can compound the danger. These high-risk groups share one thing in common: their bodies are working harder every day, often silently. Chronic stress adds another layer of pressure, making early awareness and proactive care not only helpful, but essential. Before we continue, I want to take a moment and speak to you from the heart. If this video is helping you understand your health, if it is giving you clarity or even a little peace of mind, I hope you will subscribe, like, and share Senior Health Daily. Your support truly matters. It gives us the motivation to create more life-saving content for you and for every senior who deserves guidance that is honest, simple, and compassionate. I have spent more than 30 years caring for older adults, and I know how overwhelming health information can feel. That is why this channel exists. When you support it, you help bring trustworthy education to thousands of seniors across the country who may not have anyone else explaining these issues in a way that feels human and comforting. So if this message is reaching you in a meaningful way, take a moment to subscribe, like this video, and share it with someone you love. You never know whose life you might touch with a single click. As we reach the end of this section, I want you to take a quiet breath with me and really let this truth settle in. Stress is not just a feeling that sits on the surface of your life. It is a biological force that moves through your bloodstream, your heart, and your brain. It changes the way your body functions, even when you think you are coping well or pushing through. The body remembers every sleepless night, every anxious morning, every heavy moment you carry alone. But here is the part I want you to hold on to. Your body also whispers long before it ever breaks. It gives signals. It offers small warnings. It asks for rest, for balance, for kindness. And when you listen early, you protect so much more than your physical health. You protect your independence, your ability to think clearly, your memory, your speech, your mobility. You protect the life you want to continue living. I have seen so many seniors turn things around simply by paying attention to the subtle changes that used to go unnoticed. A slight shift in blood pressure, a week of poor sleep, a sense of being overwhelmed for too long. When they honored those signals, their bodies responded with strength and resilience. Awareness becomes protection. Small choices become powerful shields. You are not powerless in the face of chronic stress. You are capable of tuning in, seeking support, and giving your mind and body the care they have earned after decades of carrying you through life. That awareness places you in the strongest position possible to reduce your stroke risk and protect your brain for the years ahead. When you listen early, you act early. And when you act early, you change the ending of the story. As we come to the end of our time together today, I want to speak to you from a place of truth and compassion. Chronic stress may look silent on the outside, but inside the body, it is never quiet. It raises blood pressure. It keeps the heart racing. It thickens the blood. It slowly shapes the conditions that allow a stroke to happen long before any dramatic symptom appears. Yet even in its quietest moments, stress leaves tiny fingerprints on your daily life. The restless nights, the heavy chest, the sudden breath you cannot explain. The morning tension that feels like it arrived out of nowhere. These are not inconveniences. They are messages from a body that still wants to protect you, and that is where your power begins. Awareness is not fear. Awareness is strength. When you pay attention to the gentle shifts inside you, you begin to protect your brain, your memory, your movement, your independence. Caring for your emotional health is not separate from caring for your physical health. They are one and the same. A small choice made daily, whether it is breathing deeply, moving gently, sleeping earlier, or simply talking to someone you trust, can lower your stroke risk more than you may ever realize. I often think about a patient who once looked at me with so much honesty and said, "If I had understood what stress was doing to my body, I would have changed my life sooner." Her words stay with me because they remind me how much control we still have, no matter our age. Change is possible. Healing is possible. Protection is possible. Thank you for spending this time with me and for choosing to learn about your health. Thank you for trusting Senior Health Daily as your companion on this journey of living well after 60. Stay aware, stay hopeful, and remember that your health is worth protecting every single day.